sobering thought, cervical cancer is the second leading cause of death in women in Guyana. The human papillomavirus, commonly referred to as HPV, causes cervical and vaginal cancers. This worrying statistic stirred the Ministry of Public Health to repilot a vaccination against the human papillomavirus in 2017. Since then, the Ministry of Public Health has mandated community health centers to embrace a robust campaign ensuring girls between the ages of 9 and 16 are immunized. Hello, welcome to InfoHub InDepth. We take a look at the measures implemented by the Health Ministry to better prevent and control cervical cancer.
The future of Guyana has never looked better. Our nation is on the cusp of a development program like never seen before. While Guyana is now emerging as an energy giant through the discovery of massive reserves of oil and natural gas, it is your government's intention that the huge benefits emerging from this will go where it matters most, to you, the people of this beloved country. There is a surge of confidence in the way Guyana is governed once again, and the level of investor interest is unprecedented. Guyana is poised to become the breadbasket of the region, and the pace at which this nation will grow through prudent fiscal management will be nothing short of impressive. But more than anything else will be the way every Guyanese, regardless of color, class, or creed, becomes a part of this historic period of national transformation, sharing in the wealth and well-being of it all as one Guyana.
The HPV vaccine is among those measures that can prevent infection from the types of HPV that mostly cause cancer. Once the girl is immunized, the possible spread of HPV can be stopped dead in its tracks. The vaccine is an inactivated injection which protects against 4 major types of HPV. These include 2 types that cause about 70% of cervical cancer and 2 types that cause about 90% of genital warts. The vaccine is routinely recommended for girls 9 and 16 years of age.
In 2012, there were approximately 445,000 new cases of cervical cancers in these developing countries. According to the World Health Organization, in 2012, an estimated 270,000 women died from cervical cancer. More than 85% of these deaths occurred among women living in low and middle income countries. In the United States of America, 10 years of vaccinating against HPV has cut infections from this cancer causing virus by 14% among teen girls. The Center for Disease Control researchers posited that there could be greater declines in HPV-related disease if there were greater coverage, and also noted that the vaccine is effective.
In 2012, Guyana was one of the first Caribbean nations to pilot the HPV vaccine in our coastline regions for our girls between the ages of 11 and 13. At the recommendation of PAHO WHO, when said vaccine was developed. Evaluation results revealed that a high update for the first dose. However, misconceptions and a lack of information to the public led to a high dropout for the second and third doses. In fact, between the years 2012 to 2014, 21,600 girls were vaccinated, with no known reported cases of death or incident. In Guyana, girls between the ages of 9 to 13 will receive the HPV vaccine, and at 2 doses instead of 3, but with the same efficacy.
The vaccine being used in Guyana is Gardasil. This is a vaccine used in the prevention of certain strains of human papillomavirus, especially type 6, 11, 16, and 18. The ministry has partnered with several key agencies, especially the Ministry of Education and UNICEF, to ensure that the awareness and education campaigns reach girls who fit the criteria to receive the vaccine.
HPV vaccination is the strategy to control cancer and prevention. This is the only one we have. And the vaccine is known more as the cancer vaccines, but actually is rather than a vaccine that is against some sexually transmitted infection. Indeed, the purpose is to prevent cancer, but those cancers are caused by what we call sexually transmitted HPV. So we heard is the common cancer for women, and we heard the number of women are dying per year. More importantly, I wanted to let you know that because of poor access to screening and treatment services, most of the cases, 80% and plus, actually of the deaths are occurring in low and middle income countries. So that means in this region is there is a high chance that unfortunately you will be infected and maybe you will die from that. So that proportion is higher for middle and low income countries.
At the national relaunch of the pilot of the HPV vaccine in Bartica in October 2017, Minister within the Ministry of Public Health, Dr. Karen Cummins, took the opportunity to administer the first dose to Shanetta Jeffrey, a 9-year-old student of the Agatash Primary School in Region 7.
Tell me when you're ready, and it's up to you. A little sting now. Just a little sting, right? It's almost over. Very good. Just put your hand on it. 15 minutes to this.
The Pan American Health Organization, World Health Organization, has supported the Health Ministry in every step of this process. Dr. Janice Wolford, Family and Community Health Specialist of PAHO WHO, said the measure of reintroducing HPV vaccine is one that can be most effective in combating cervical cancer and other HPV-related infections.
In 2015 and 2016, the Global Alliance for Vaccine and Immunization, which is called Gavi, awarded support to Guyana for the introduction of HPV vaccine through PAHO WHO. This support was a cost of US $4.5 per dose of vaccine, as well as other support for immunization services. PAHO WHO will continue to support the vaccination program through building capacity, social media campaign activities, and providing access to remote services.
Other launching activities took place in other communities throughout the country. More than 36,000 girls between the ages of 9 and 16 are targeted to be immunized with the HPV vaccine following the relaunch of the immunization campaign.
One of the major challenges experienced in familiarizing the public with the new vaccine was the myths and misconceptions peddled. The HPV awareness campaigns, hosted by the Public Health Ministry with support from technical bodies like PAHO WHO, engaged parents, school teachers, and other relevant stakeholders.
The first official pilot of the human papillomavirus had failed following false impressions circulated about the vaccine. The Public Health Ministry has presented facts to Guyanese in an effort to change the view of the public since then. Consultant and gynecologist Dr. Vikash Chatrani has brought his expertise to contribute to the ministry's efforts to spread the truth about the vaccine.
As any good parent, you want to make sure that if your child is getting something, it's not going to cause them any harm. The HPV vaccine is safe. Most of the side effects are related to injection site issues, which is like burning, injection site problems like redness, which you get with every vaccine, right? Because it is a stick that you're getting with a needle. You may get a fever with it, which is your immune response, which is your body responding to the vaccine. You get that with all the other vaccines. There are no weird and wonderful side effects that you read about. With the HPV vaccine, it does not cause infertility. It does not cause hormonal imbalances. It does not cause death. There is no conspiracy behind this vaccine that it causes population control. It is safe.
Minister of Public Health, Waldo Lawrence, has indicated the HPV vaccine is on the ministry's front. They will engage more with citizens as they seek to dispel misconceptions and false rumors circulating. She emphasized the effectiveness of such a vaccine, noting that the prevalence of cervical cancer can be reduced. She further reiterated that the myths and misconceptions of the human papillomavirus vaccine must be put aside, since administering the injection is the key to preventing the disease.
We have the responsibility to protect our children, especially our 9 years to 13-year-old. we have that right and that responsibility to ensure that they are vaccinated, and in so doing, that we can ensure that they can live a healthy life without cancer.
Minister Lawrence, a cancer survivor herself, said the opportunity is provided to ensure that girls are vaccinated early, something she did not have.
So let us put aside the myths. Let us put aside the stories. And let us get our girls immunized. When the cancer comes, no myth helps you then. No stories help that child then. The parents are crying. The family is depressed. And everybody is looking for a miracle.
UNICEF country representative Paolo Marchi supported the minister's call for the public to be more open to the HPV vaccine. He pointed out there is an unchanging fact: the vaccine can work and saves lives.
I think today is a day in which we need to remind ourselves and scream again that vaccines save lives and vaccines work. Sometimes, unfortunately, there are misconceptions about vaccines. There are misconceptions about the effects of vaccines, and there are misconceptions about the fact vaccine can work or not. We have these are misconceptions because we have proof. Vaccines save lives, save children's lives from preventable diseases every year, millions of children's lives.
Dr. Chatrani reinforced that as people become more aware of the availability of the vaccines, some persons will seek to educate themselves through different sources. While it's commendable, he said not all information made public is accurate. The challenges with Guyanese accepting the HPV vaccine is one that has been experienced in other countries as they sought to introduce the vaccine.
Guyana has not tried to start it. Guyana was the first country to pilot the HPV vaccine program back in 2012. And the same challenges that are being experienced here have been experienced worldwide. People are concerned. When you are a parent, you don't want any harm to come to your child. What you don't realize is that when you were a parent and your child had to get the MMR vaccine, the child was 2 months old. You took the child to the healthcare center, the child sat on your lap, you lifted up that sleeve, and the child got injected with the vaccine. Now you have to sign a consent form. And as any parent, anytime you're going to sign a consent form, you want to make sure that you're doing it with the best knowledge that you have. And there is a lot of misinformation on the internet. There is good information, but there's a lot of misinformation. If you read something that gets you scared, you're not going to sign that form. So the same way that we have children being vaccinated against other conditions and accepting it, now that we're offering it in schools, in the health centers, and you have to sign a consent, people are doing more research, and that is good.
Even as some persons seek to educate themselves via the internet, the push has been greater to familiarize and educate even more Guyanese.
Following the successful repiloting of the HPV vaccine nationally, it was then taken to schools and health centers throughout the country. The Ministry of Public Health kept the momentum and continually kept the topic of HPVs and cervical cancer in the public's eye, labeling it a big deal. The benefits of the HPV vaccine became a topic of major importance to the Guyanese public.
Doses of Gardasil vaccine is all she really needs. MoPH is offering a public service to guard our girls between the ages of 9 to 13. So I'm pleading with the parents to please sign the release. The high-risk group is between teens to 30s. Prevention is better than cure, so early get screened and tested at your public health facilities and your private doctors. You see, there's different types of this one disease. That's why 7-to-1 countries has introduced the vaccine nationally into their immunization routine. You see, though it's safe and free, our government still pays a fee. So they work with the girls that are turning women strategically. Because if 95% of girls or more gets the vaccine, that means the boys are automatically protected. It's a big deal. Our general health. I'm talking no unwanted warts for you or cancerous tumors that are hindering productivity in the womb. I said it's a big deal, especially the health of the youth. So you know it's the truth when I say it's time for me and you to let's guard our girls from HPV disease, which can cause cancer of the cervix. You see, 2 doses of the HPV vaccine is all she really needs. The Ministry of Public Health is offering a public service to guard our girls between the ages of 9 to 13. So I'm pleading with the parents, please sign the release.
The HPV vaccination campaign focused mainly on awareness of the vaccine and educating parents on their responsibility of signing the consent forms and having girls be more aware of their health in this regard. The HPV vaccination consultant to the Ministry of Health adds that the vaccination campaign will be most effective if persons are open to information presented.
Like any other vaccine, it works on the same principles. It boosts your immune system so that when you do come into contact with the HPV virus, you're able to clear it from the body and prevent persistent infection. It's infection with HPV that causes you to get abnormal pap smears. It's infection with HPV, the high-risk types, that cause you to get cervical cancer. There are many vaccines out there. We have a national immunization program in Guyana. We no longer see mumps, measles, rubella. We don't see polio. People don't even know what they cause. Polio causes paralysis that is lifelong. And the same way the population of Guyana has embraced these vaccines and cured diseases like polio, they need to embrace the HPV vaccine. We need that in a time where HPV is killing the women of Guyana because it's causing cervical cancer, the #1 cancer in Guyana, surpassed breast, and it's causing most of the deaths from cancer.
The ministry stopped at nothing collaborating with relevant stakeholders to get the message across. The campaign was not limited to live concerts, but persons with a vested interest in the reduction of cervical cancer deaths in Guyana. Dr. Cummins reminded that the campaign is part of the Ministry of Public Health's plan to control the number of cervical cancer cases. Upon recommendation of a technical group, the campaign will target girls 9 to 16 years, with the end goal of achieving 90% coverage of the target population.
We want the public to know that early detection saves lives. This walk is a very timely walk as it's coming in the heels when we had one cancer patient, cervical cancer patient from Alveston and the Currentine, a mother of 5, succumb only last week. And so we want to say it's prevention. Help is available in all of our hospitals across the regions 1 to 10, except region 8, which we're going to do launch this year. And so they can go to the health centers and do the test. There are basically about 3 tests we can do.
This is no different to any other viruses out there. What is different now is that we have a vaccine against the human papilloma virus, and this virus is responsible not only for cervical cancer, it's responsible for anogenital warts, it's responsible for other cancers, head and neck cancers, penile cancers, anal cancers. So yes, we're targeting girls because we're targeting women who get affected by cervical cancer. But hopefully, eventually, as your budget expands, boys would also, like in Trinidad, boys get it, and women get it up to 45 in Trinidad. So we're now starting. You need to start someplace. The ministry is very committed to the rollout of this program, and I think it's going to be successful. Knowledge is power. The only stupid question is the one that is unanswered. When you have a question regarding it, you ask it. And that's the only way you're going to get it clarified, okay? And that's what we did today, today's town hall meeting. We had representatives from the police, from the PTAs, teachers, from faith-based organizations, from different NGOs, to parents, They had two young gentlemen that stood up in the audience who had 3 daughters each. And they asked, they listened, and they felt reassured that this is something safe, that this is in the best interest of their children, of their daughters, in the best interest of Guyana.
Healthcare providers will be visiting schools within the respective communities and holding discussions with the teachers as well as children in order to allay fears that they might have.
With an average incidence of cervical cancer being 46.9 per 100,000, there has been a call to action, and the Ministry of Public Health is leading the charges to reduce the number of cases of HPV in Guyanese women and girls. This brings us to the end of this week's InfoHub InDepth. Join us again next week.
Roundabouts. Approaching a roundabout. When you approach a roundabout, you must use your indicator if you intend to turn left or right or make a U-turn at the roundabout. You must give other road users sufficient notice of your intent to turn. Entering a roundabout. When entering a roundabout, you must slow or stop to give way to any vehicle already in the roundabout. You must also continue to use your indicators if you intend to turn left or right or make a U-turn. Turning left. When turning left, you must indicate left on approach and be travelling in the left-hand lane unless there are road markings with other instructions. Stay in the left lane and exit in the left lane. Turning right. When turning right, you must indicate right on approach and be travelling in the right-hand lane unless there are road markings with other instructions. Making a U-turn. When using a roundabout to make a U-turn, you must approach in the right lane and signal right. Changing lanes in a roundabout. Drivers may change lanes in a roundabout if they wish. The usual road rules for changing lanes apply. You must use your indicator and give way to any vehicle in the lane you are entering. Going straight ahead. You don't need to signal when approaching the roundabout if you are going straight ahead. You may approach the roundabout from either the left or right lane unless there are road markings with other instructions. Exiting a roundabout. As when you exit a road, you must signal left when leaving a roundabout, if it is practical to do so, and you should stop indicating as soon as you have exited the roundabout. However, when you are travelling straight ahead on a small single-lane roundabout, it may be impractical to indicate when exiting.